Welcome. I am so excited to have everyone here today. Thank you so much for tuning in to this live study with me. So if you are new, I will introduce myself in just a second here, but we're going to get it done. We're going to study. It's a Wednesday night. I hope you all are having a fantastic week so far. Even if you don't feel like studying, I'm so proud of you for showing up today. We have a really good lecture lined up. We're going to talk about Guillain-Barre Syndrome. So we are starting our neurovascular disorder mini-series, and today we are going to cover Guillain-Barre. So a really exciting lecture lined up for you guys, so I am excited to get started. I'm going to jump right in here. Just turn this off. Okay, there we go. All right, and then if you guys do have any questions as I'm lecturing, it's a little hard for me to watch the comments and answer questions as I'm lecturing. But if you have a question or a comment, please drop it in the comment section, and I will have a Q&A at the end, so I'll make sure that I get to your question. So as we go through this lecture, whatever thoughts come to your head, make sure that you drop them in the comment section. And if you have any, personal questions for me, I'm an open book, so always feel free to ask me anything. Ask me anything you want. And then if you guys stick around till the end, I have some amazing offers that you don't want to miss out on, so make sure that you stick around until the end. And I might even give you a little tiny sneak peek into what is changing on the upcoming NCLEX. So I had the privilege of sitting in for the NCSBN NCLEX conference, and they gave me some inside scoop on what's changing in the NCLEX. So stick around, and I'll give you a few hints, a few little details on that. But more to come, more to come. And then do me a favor and let me know where you're watching from. I always like to see where my students are tuning in from. I have students all over the country, outside of the country, so let me know where you're watching from. And if you're watching this live, why don't you comment #live? And if you are watching the replay, I will post the replay to this tomorrow. If you're watching the replay, make sure you comment #replay. All right, guys, so we are going to jump in and get started. So just some quick tips and tricks for you guys, not only just for this study with me live, but also when you are just studying in general. It's really important that you limit any kind of distractions that are around you. If you have distractions and you get easily distracted, it's going to break your concentration. So it really impairs retention of information. So you want to make sure that you are limiting as many distractions as you can. Also find a quiet place to study, again, just to make sure that you are eliminating those distractions. And you also want to turn off your cell phone notifications. I know we all get tempted to just mindlessly scroll on social media, and I know that I am streaming right now live on social media, so you get an exception today. But if you are just doing regular studying, make sure you turn off those cell phone notifications. And also the same thing goes for the TV. All right, so again, hopefully most of you know me. You all should know me, but if you don't know me, my name is Nurse Kelly Tyrell. I just go by Kelly, but you guys can call me Kelly, you guys can call me Nurse Kelly, whatever floats your boat, you can call me. I will answer to all. So just a little bit, very quick background about me. So I have been a nurse for over 10 years, about 12 and a half years. I have been a nurse, and I became a nurse because my sister, my older sister, shout out to you if you're watching. You might be watching because she is sick right now, guys. So keep her in your prayers. She was diagnosed with pneumonia and she's getting tested for COVID. So hopefully it is not that and it's just pneumonia, but she's not feeling too well. So keep her in your prayers, you guys. But she was born with a congenital heart defect called tetralogy of Fallot, which I actually covered, I think, in my last study with me live. So she, basically grew up in children's hospitals, and I was right there along with her, and I saw the way the nurses cared for her, and it really inspired me to want to become a nurse. And they saved her life, more times than I can even remember. So that's why I wanted to enter into the field of nursing. So went into nursing, went through nursing school, and passed my NCLEX in the minimum amount of questions, which I'll talk about a little bit later. And then shortly after graduating nursing school, I became a preceptor and a nurse mentor to other new nurses who were just entering into the nursing field, and I really found my passion. I absolutely loved it. I love teaching. I love mentoring. I love precepting other new nurses. And I have a really diverse nursing background, which is what is really cool about the field of nursing. You can really test out a bunch of different specialties. So I have a background in cardiac nursing, ER and trauma nursing, also in case management, and then in an acute rehab hospital where I was an admissions director. So a wide, diverse nursing background. And then a couple years ago, I went back to my true passion, which was teaching and mentoring, and I became a nurse educator. So I've been doing that ever since, helping you guys pass your NCLEX and get through nursing school. All right, so like I said, today we are going to start our neurological disorder series, and we are going to talk about a syndrome called Guillain-Barre Syndrome. And we're going to start by talking about pathophysiology. And feel free to take notes, you guys. If you write down things, you can remember them easier. So feel free to take notes, and there might be a pop quiz at the end. So make sure you're paying attention because we are going to do a pop quiz at the end. All right, so let's talk a little bit about Guillain-Barre. So what exactly is Guillain-Barre? Well, Guillain-Barre is an acute, which means that it is a sudden onset, and it's a progressive autoimmune disease, and it attacks and destroys the myelin sheath within the nerve columns throughout your body. So we have a bunch of these nerve conduction columns throughout our body, and they're called axons. So they're like little cables that go all throughout our body, and they're responsible for delivering nerve impulses to our muscles, to our tissues, to different organs. let me admit this person. So they're responsible for delivering all of those nerve impulses. That way we can function day to day. So what happens with Guillain-Barre is the patient's own immune system starts attacking something called the myelin sheath. Now the myelin sheath, it surrounds these axons, and it's like a protective coating on these axons. So think about the axon as like, think about the myelin sheath as like a cable cord. So you have a cable cord, and inside of the cable cord, you have the electrical impulses that run inside of the cable cord. And then on the outside of the cord, you have that rubber outside. And that is going to prevent those neurological impulses from escaping the cord. Because when you have a severed cord, all of a sudden you get sparks and you get the electrical current that comes outside of the cord. So that is basically what happens with Guillain-Barre. So the patient's own immune system is attacking these axons, and the myelin sheath is being destroyed. And this is going to be a very fast onset. And these patients, they're going to experience rapid paralysis. And we're going to talk about the different types of paralysis in just a second. But you don't want to confuse this disorder with another common neurological disorder that will be in a future lecture called multiple sclerosis. Because multiple sclerosis also is a disorder where the immune system attacks that myelin sheath. But they're different symptoms, and multiple sclerosis is a very slow progressing disease. So that is what is going to separate, that is one of two things that is going to separate multiple sclerosis from Guillain-Barre. Guillain-Barre is a very rapid and fast onset. The second thing that's going to separate Guillain-Barre from multiple sclerosis that you want to remember is that Guillain-Barre syndrome is going to follow some kind of bodily insult. So what does that mean? Well, it's going to follow some type of infection, or it could be surgery, it could be another acute illness. Also women who give birth, or if you've received an immunization, sometimes you have an autoimmune response to that, and you can have this Guillain-Barre syndrome. So those are the two things that are going to separate it from multiple sclerosis. It's going to be a very fast onset, and it is going to follow some type of acute bodily insult. So those are the two things that are going to separate these two disorders. Now, we have two different types of paralysis with Guillain-Barre. So the first type of paralysis is going to be ascending paralysis. So what does that mean? That means that the paralysis is going to start at the most distal part of the body. So it's going to start at the feet and the legs, and it's going to ascend upward. So that is the ascending paralysis. And this is the most common type of Guillain-Barre. And then the second type of paralysis that you're going to see is you're going to see descending paralysis. So the descending paralysis is going to start in the face, and then move down to the neck and move down to the rest of the body. This is not as common, but I will tell you that these patients become compromised more quickly because the paralysis is going to start higher up. And what is higher up? Your throat, your diaphragm, your lungs, and that is necessary obviously for patients to breathe and to swallow and to eat. So they are going to become compromised more quickly. They're going to get sicker faster. So what is our primary nursing concern with patients who have Guillain-Barre? Your number one, hands down, primary nursing concern is going to be respiratory compromise and failure. And you want to think about your ABCs. In my course, I talk about the ABCs and using that to prioritize how you're going to treat patients. So you want to think about your ABCs. Airway is always number one. So with Guillain-Barre, they are going to have paralysis all throughout their body, whether it be the ascending type or the descending type. Once that paralysis hits the level of the diaphragm and those intercostal muscles at the rib cage, the patient is not going to be able to take deep breaths because our diaphragm muscles help to facilitate breathing in and breathing out. So if they're having paralysis at the level of those muscles, they're not going to breathe effectively. So your number one concern as the nurse is going to be respiratory compromise and failure. And another important thing to note is that these patients, they will not lose their level of consciousness, their mental status, their personality, and their pupil size will not be affected. So they will be very well aware of what's going on. So you want to make sure that you give them a lot of emotional support because this is going to be a really, really scary disease for them because they are going to be fully aware that they are losing the sensation throughout their body and that they will likely need to be placed on a ventilator. But they will be completely oriented throughout the whole process. All right, so let's talk about some hallmark signs and symptoms. So the first symptom that these patients are going to experience is a burning, a numbing, or a tickling feeling. And like I said, if it's going to be the ascending type of paralysis, then they're going to start feeling those sensations in their feet. And then the descending, they're going to start feeling them in the face. They're also going to have symmetrical weakness or flaccid paralysis. Now, this is really important to remember because you don't want to confuse asymmetrical paralysis that you typically see in stroke patients with Guillain-Barre. With Guillain-Barre, they're going to have paralysis on both sides of their body, whereas if somebody is presenting with a stroke or stroke-like symptoms, they're just going to have paralysis on one side of their body. And that, I'm going to be talking about stroke more in detail next week. So you want to make sure that you watch that lecture on my YouTube channel next week. So we're going to be talking about that. But you don't want to confuse that symmetrical weakness with asymmetrical weakness that you typically see in stroke patients. So another sign and symptom is you're going to see absence of those deep tendon reflexes because reflexes are a sensory motor response at the spinal level. It's not at the brain level. So as these myelin sheaths become deteriorated by the autoimmune process and they start breaking down, and then the paralysis starts setting in, the patient is going to lose those deep tendon reflexes. So that's one of the things that you're going to want to monitor and assess as the nurse. Also, again, you want to make sure that you are asking about any type of recent infection or surgery or acute illness, childbirth, or vaccinations when you suspect that your patient is presenting with Guillain-Barre symptoms. And then symptoms typically start within a few days to a few weeks after the patient has had some type of bodily insult. So getting that good past medical history with your patients is really going to be one of the keys to identifying this Guillain-Barre and identifying it early. Another sign and symptom that you're going to see is you're going to see something called labile blood pressures. And what labile means, it just means fluctuating or changing rapidly. So you're going to see sometimes high blood pressures, then the next blood pressure might be low, then it might be high again. So you want to watch out for drastic fluctuations in the blood pressure and also different cardiac arrhythmias. So this is happening because we have something called an autonomic nervous system response within our body. And the axon pathways that I had talked about earlier that carry those nerve impulses, it's also involved in the autonomic nervous system. So again, as the myelin sheaths continue to deteriorate, those nerve impulses are not going to act appropriately. They're not going to get to where they need to be. So they're not going to get from the brain to the heart to regulate blood pressure or to the kidneys. So you're going to start seeing these cardiac arrhythmias because the electrical system in the heart, it's not going to function properly. And then also these fluctuating or changing blood pressures. You're also going to see difficulty breathing. Again, as that paralysis raises or descends to the level of the rib cage and the diaphragm, because those muscles help us breathe in and out. So as the paralysis gets to that level, these patients are going to have a really hard time breathing, and they are likely going to end up on a ventilator, which we're going to talk about in just a second. So what are some diagnostic tests that we are going to run in order to confirm this diagnosis that we suspect patients have? The first test we're going to run is something called a lumbar puncture. So the doctor is going to take a little needle, and they're going to, in the spinal canal, and they're going to extract some cerebral spinal fluid. So what are we doing this for? What are we going to be looking for? Well, we're going to be looking for increased protein, because the myelin sheaths that surround those axons, they are a protein. They're made up of protein, primarily of protein. So it would make sense that if these myelin sheaths are being destroyed, then that protein is going to be entering into that cerebral spinal fluid. So you're looking for a really high protein level in the cerebral spinal fluid. Now, this can take up to 2 weeks after the patient starts showing symptoms in order to have that increased protein. It can take up to 2 weeks for the myelin sheaths to break down enough that you have enough of that protein that enters into that cerebral spinal fluid. So the lumbar puncture is not going to be your end-all be-all. It's not going to be your primary way to diagnose these patients, but it is something that you definitely want to look out for as having those high protein levels. But you also want to keep in mind that it can take up to 2 weeks for those protein levels to become elevated. Next, we're going to look at a nerve conduction study. So that is going to test how fast those electrical impulses are being moved from those axons to the muscle. So obviously, if patients are experiencing paralysis, then you're going to see slowed velocity of conduction. So meaning that it's going to be a slowed connection between the axons into the muscles. So everything's going to be slowed down. You're going to see slowed velocity. The next test that you are going to anticipate having to do is a pulmonary function test. So what are we going to be looking for in a pulmonary function test? Well, we're going to be looking for 2 things. The first thing we're going to be looking for is something called low tidal volume. What that is testing for is the amount of air that is coming into the lungs and coming out of the lungs. You're also going to be looking for something called vital capacity, and it's going to be low with these patients, so low vital capacity. And that is really testing the amount of air that is going to be able to forcefully be pushed out of the lungs. So how well are those lungs emptying out and pushing out all of that CO2? So that is what that vital capacity is testing. And obviously that is going to be low, because if you don't have the diaphragm, muscles there to help push out that CO2, then your vital capacity is going to be lower. All right, so let's talk about some treatments. So what are we going to do for these patients? Well, there's 4 primary treatments that you want to be familiar with. So the first treatment is going to be placing the patient on some type of mechanical ventilation, whether that be through an endotracheal tube or whether that be through a tracheostomy. And it's important to remember that it is always better to be proactive in securing an airway than it is to be reactive, because you don't want to walk into your patient's room and find them in severe respiratory distress or respiratory failure where they're not breathing at all. And then that oxygen and that glucose is being cut off from the brain, and then now you're in a reactive situation. So you're against the clock. You have to act really, really fast in order to get an airway to get that oxygen to the patient. So with these patients who have Guillain-Barre, typically the paralysis is going to move throughout the entire body. So they're going to get worse before they get better. So more likely than not, depending on the severity of the Guillain-Barre, but more likely than not, these patients are going to need some kind of mechanical ventilation. And usually it is through a tracheostomy tube, because these patients are going to need an extensive rehab stay. It is going to take them months to recover. So they're going to need long-term airway management. So typically the doctors will opt to do a tracheostomy, but if it's an emergency situation or they think that, the paralysis is not going to last that long, then they will put in an endotracheal tube. That's more for short-term airway management. They'll do an endotracheal tube, but usually they'll end up moving to the tracheostomy. Also, you'll want to anticipate putting an NG tube in, because the NG tube is going to make sure that patients can get, get some food and hydration. If they are having paralysis at the level of the stomach, then that food is not going to be able to move through the digestive system. So we're going to want to puree all of their foods, and then once it gets to the level of the throat, they're not going to be able to swallow or handle their secretions. So they're not going to be able to eat on their own. So you want to make sure that you put an NG tube in, that way they can get some nourishment. All right, so these next two are definitely going to be your gold standard treatment. So you want to star these, you want to mark these, you want to remember these, because these are very specific to Guillain-Barre Syndrome. And the first one is going to be plasmapheresis. So plasmapheresis is basically the process of removing all of the patient's natural antibodies from their bloodstream. And why are we doing this? Well, we're doing this because we said that this syndrome is a result of the patient's own immune system attacking the myelin sheath around these axons. So if the patient's own immune system and antibodies are attacking itself, we want to try to get them out as fast as we can. So we're going to do this plasmapheresis treatment, and we're going to remove all those antibodies. And then after that, we're going to do something called immunoglobulin therapy, or you'll also see it as IVIG. And what that is it's using donor plasma that has healthy antibodies, and we're basically replacing these antibodies back inside the patient. And the hope is that the donor antibodies will actually start attacking the Guillain-Barre syndrome antibodies. If there are any like residual antibodies left, then the healthy antibodies from the donor plasma will start attacking those Guillain-Barre syndrome antibodies. So you're going to remove all the patient's natural antibodies, then you're going to replace them with donor plasma. So those are two gold standard treatments for Guillain-Barre syndrome. Okay, so let's talk about some nursing interventions. What do we need to be aware of? What do we need to monitor? What do we need to assess for these patients? So the first nursing intervention is obviously you're going to want to monitor the progression of the paralysis, and you want to monitor any kind of change in sensation. So how we're going to do this is we are going to do frequent neuro checks, neurovascular checks. That's typically done every 2 hours, or it's done according to the doctor's order. Typically neuro checks for Guillain-Barre, especially in the beginning, are done every 2 hours. Next, we're going to want to make sure we're frequently examining that respiratory status. So we're looking at the effort, we're looking at the rate, we're looking to see if the patients are becoming breathless when they're speaking. Are they able to speak in full sentences, or do they have to take frequent breaks while they're speaking? Also looking for use of accessory muscles. So looking at their collarbone, are they using any of those muscles around their collarbone? Looking at their neck, their muscles that lie along the neck and the tops of the shoulders. So when they're taking breaths, are those muscles contracting and relaxing with each breath? You're going to look for those different accessory muscles. We're also going to want to monitor vital signs, and we're going to want to monitor them pretty frequently, at least every 4 hours. And what we're going to be looking for, again, we're going to be looking at that blood pressure to see if we're seeing those labile blood pressures or those fluctuating blood pressures. We're going to monitor that heart rate. So is the heart rate fast? Is it slow? Is it irregular? Are they having any kind of cardiac arrhythmias from that autonomic nervous system disruption that we talked about? Also the pulse oximetry. So we're going to be looking to see if that patient is able to move air back and forth, having normal air exchange. And if that pulse oximeter drops to 92% or below, we want to make sure that we're alerting the physician of that, because that means that the patient's not moving air correctly, and they could be going into respiratory failure. So anything less than 92 is going to be concerning. You want to make sure that you notify the provider of that. We also want to monitor the gag reflex. So funny story, when I was a new nurse and I was just learning how to monitor the gag reflex on patients, just a word of wisdom here. When you monitor that gag reflex, It doesn't take much, okay? You don't have to stick that whole entire tongue depressor down the patient's throat, because what's going to happen? They're going to throw up. And yes, it did happen. The patient threw up because I was trying to monitor the gag reflex and I stuck the tongue depressor down a little too far. Look, nobody's perfect. It happens. But here is your words of wisdom. Do not stick that tongue depressor all the way down the throat. It literally just takes a little tiny tickle on the sides of the pharynx at the back of the throat for them to start gagging. So it does not take a lot. Trust me from personal experience, it doesn't take a lot to get them to gag. You also want to monitor visual changes. So your eyes are held in by muscles. You have muscles behind your eyes. So the paralysis is going to affect every single muscle in the body. So these patients are going to start experiencing blurred vision. They're also going to be experiencing double vision, or it's also known as diplopia. So if you see that term, that just means double vision. So you want to make sure you're doing visual acuity checks on these patients as well. The next thing you want to monitor is speech and communication. So are they having slurred or muffled speech, or is the tone of their voice becoming really soft and quiet, like they're talking in a whisper? Because again, you have some muscles surrounding your vocal cord. So as the paralysis moves into the throat, the tone of the voice and the loudness and softness, it's going to change. It's going to become quieter. Also, turning and repositioning. So you want to make sure that you're turning these patients every 2 hours, because they are going to be at high risk for skin breakdown. As the paralysis sets in, they're not going to be able to turn themselves. So anytime you are laying on one surface for a long period of time, you have a lot of pressure on that area, and the patient is going to be at risk for developing pressure sores, which is going to be a whole other complication that you don't want. So you want to make sure that you are doing frequent skin checks and that you are turning and repositioning every 2 hours to prevent those pressure sores. And the last nursing intervention, I touched on it a little bit earlier, is you want to make sure that you're consulting social work and chaplain services, because again, these patients are going to have a very long recovery ahead of them. This is a very sad disease to watch your patients go through, but the good news is that typically, eventually, they do end up recovering, usually not to the fullest extent that they were prior to getting it, but they are, for the most part, they will be functional again, but it's going to take a long time. So it's really important that they have these support services set up for them during their recovery. And they're typically going to have to recover in some kind of acute rehab hospital, which I have a lot of experience at. That's where I was an admissions director. So as the admissions director, I reviewed every patient that came through the hospital. So I saw a lot of Guillain-Barre patients that have come in, and I've seen them come in, with a tracheostomy tube, and within a few months they were able to walk out the doors. So they will get better, but it's going to take a long time. So that emotional support is going to be really, really important. Not as important as managing the airway, though. Airway is always number one. All right, pop quiz time. Who is paying attention? Let's see. Let's test your knowledge. Hopefully you guys were taking notes. Okay, so question number 1. What is the primary nursing concern in patients with Guillain-Barre syndrome? And everyone should get this right. This is an easy one. They're going to start easy. They're going to get a little bit harder. What is the primary nursing concern in patients with Guillain-Barre syndrome? Is it A, bowel and bladder control, B, slurred speech, C, diplopia, or D, respiratory compromise and failure? What do you guys think? I will be checking the chat. All right, I heard somebody say D. I'm seeing some D's come across. You guys were taking notes today. Very good. Respiratory compromise and failure. Think about your ABCs: airway, breathing, circulation. So respiratory compromise and failure is always going to be your number one concern with these patients. All right, question number 2. All of the following are signs and symptoms of Guillain-Barre syndrome, except absent deep tendon reflexes, labile blood pressures, asymmetrical paralysis, difficulty breathing, recent bodily insult. What do you guys think? All of the following are signs and symptoms of GBS except absent deep tendon reflexes, labile blood pressures, asymmetrical paralysis, difficulty breathing, or recent bodily insult.
C.
What do you guys think? I hear a C. I hear a C. I see a couple E's. Somebody changed and said OC. Let's see. It's C, asymmetrical paralysis. So remember I talked about that asymmetrical paralysis is very classic of a stroke patient. Stroke patients are going to have that asymmetrical paralysis. Guillain-Barre patients, they're going to have paralysis on both sides symmetrically. And some people said E, that recent bodily insult. So that is very typical with Guillain-Barre patients. They're going to have some type of infection or surgery or childbirth, some other kind of acute illness or immunization. So they're going to have some kind of recent bodily insult before they start showing symptoms of Guillain-Barre syndrome. So very good, you guys. All right, next question. When doing a lumbar puncture, what specifically are you looking for in a patient with suspected Guillain-Barre syndrome? Are you looking for a high white blood cell count, a high protein count, a low white blood cell count, or a low protein count? What specifically are you looking for when doing a lumbar puncture in these patients with suspected Guillain-Barre?
High protein count.
High protein count. You were on it today. Very good. High protein count, yes. And that is because these myelin sheaths that cover those axons are made primarily of protein. So as they are being destroyed and broken down, they're going to start circulating through that cerebrospinal fluid. So very good. High protein count is what we are looking for. All right, two-part question. So blank is the process of removing antibodies from the blood, and blank is the gold standard treatment to replace healthy antibodies in patients with GBS. So is it dialysis and IVIG? Is it IVIG and plasmapheresis? Is it a blood transfusion and dialysis? Or is it plasmapheresis and IVIG? A, B, C.
I think the removal is the D, plasma, and I don't know. The second one is dialysis or something. I don't know. I'm not sure on that.
Okay, good effort though. Good effort. What do you guys think in the chat? Seeing a B, seeing a D, seeing a D. Okay, let's see. Yes, so it's D. So plasmapheresis is actually very similar to dialysis. It has the same concept, it's just doing two different things. So when a patient's going through dialysis, they are getting their blood removed and they are filtering out all of those electrolytes. So they're regulating electrolytes with dialysis and they're removing any kind of extra fluid because the kidneys typically do that. But patients who are placed on dialysis, they have some kind of kidney dysfunction. So that's why they need to be placed on dialysis. But it is a very similar concept to plasmapheresis. So we are just basically removing the patient's plasma and we are extracting all of their natural antibodies. So that's what plasmapheresis is. And then we have to replace those antibodies back, and we're going to do that by giving them donor plasma and through a process called IVIG, so IV immunoglobulin. So So we're going to replace those antibodies with donor antibodies in hopes that they start attacking any residual natural antibodies that the patient has. So plasmapheresis and IVIG. All right, so if you haven't already, please subscribe to my YouTube channel. It helps me out a lot when you guys subscribe and watch my videos. I'm going to go into this lecture a little bit more in detail. Not tomorrow. Typically my lectures come out after my lives. They come out every week, Thursday and Friday, but my schedule is a little bit different. My lecture is actually going to come out next Thursday and Friday because I'm going on vacation. I'm going down to Mexico, so really excited. But my schedule got a little wonky. So I don't have my lectures coming out Thursday and Friday. I will be posting this replay live tomorrow, but then I will resume my normal pre-recorded lectures on YouTube next Thursday and Friday. And then I won't be going live next week. I won't have my study with me live next week because I will be on vacation. So, but make sure you head on over to my YouTube channel after we're done here and subscribe and watch my videos. Give them a thumbs up if you learned something. It really does help out my channel a lot. And it helps me to keep doing these videos for you. So I really appreciate it. And just to let you know, if you are a part of my UNursity community, all of the slides from tonight's lecture will be posted tomorrow in my UNursity community. So you'll have access for free. All of these slides, you'll be able to download them. You can print them out. You can use them as notes. You can refer back to them. So they will be available tomorrow in my UNursity community. And if you're thinking, what the heck is UNursity community? I don't know what that is. I'll just tell you quickly. So my UNursity community is basically an all-in-one nursing resource hub where you can expect to get coaching, community, and content. So you get coaching and mentoring from me. I'm in that community every single day, talking to you guys, answering questions that you may have. Also the community. So I have a diverse group of nursing students in my community. So you'll be able to network with other nursing students, hear their different perspectives and kind of bounce things off of each other. So we have a really great and strong community of nurses in that group. And then also content. So I'll go into the content here. There's two different types of content. I have my daily content and then I have my monthly content. So the daily content, this is what our calendar looks like. So Monday through Friday, we do practice NCLEX questions. So we do the different format questions that you will expect to see on the NCLEX. We get some practice with those during the week. Monday, we do an engaging poll or ask a question, and that is really for me to get to know you guys better and for you to let me know if there's anything that I can do better in the group. So I like to do those on Monday. Tuesdays are Quick Tip Tuesdays. So I give you guys quick tips that you'll need to know as a nurse, anywhere from assessments to lifespan to procedures to lab values. Just things that you'll want to have in your back pocket as you go through your nursing journey. We do the study with me live on Wednesdays, and you guys get exclusive access to the lecture notes. So that is something that is only released inside my community. Thursday and Friday, you get the educational videos that I do post to YouTube. But what is exclusive to the group is that you get the post-lecture quizzes after those videos to make sure that you are testing and retaining what you're learning. Also Saturday, inspiring quote cards. So I'm big on just giving you guys things to help make you feel good, give you some positive affirmations. So that is on Saturday. And then Sunday is my nursing blogs that I personally write. So it's basically my nursing experience. So there's a little bit of education in there as well as my own personal experience. And then our monthly downloads. So I focus on 2 different topics throughout the month. And then I give you guys monthly downloads that you can use to study either for your nursing school exams or for your NCLEX. So the monthly bundles include flashcards, infographics, physical assessments, practice questions, worksheets, skills checklists, and procedure assessments. And I also have a really cool ambassador program if you guys are new to the UNursity community or didn't know about the ambassador program. So basically, if you invite your nursing student friends to join the UNursity community, you get rewarded for that. So the program is when you refer at least 2 members up to, I think it's 100 members, you earn anywhere from $20 to $550. And you have the option to either take a cash prize, or I have some really cool nursing swag that I picked out for you guys that is of equal cash value. So you have the option to do both. So that is another benefit to joining UNursity. You can earn a little bit of extra cash on the side. And then when you guys are ready to take your NCLEX, I do have a really amazing program for you guys. It's called NCLEX and Chill Review. And this is a review that I have poured my heart and soul into. A lot of blood, sweat, and tears went into this review. But we are really proud to have a 99.3% success rate from this program. So I'm just going to talk very quickly about the benefits of the NCLEX and Chill Review. So this review is really for everyone. It's for first-time test takers, it's for repeat test takers, it's for international students, it's for busy students who need to study when it's convenient for them. I made this program self-paced, that way it can fit into anyone's lifestyle. And the results are guaranteed, and we have proven results. So I'm so confident that you will pass your NCLEX using my review. And if you don't, I guarantee that you stay in my program absolutely for free until you pass, because I want you to pass. I want you guys to have your license. So this is just a way that I can reassure you guys that you will do it. You will pass your NCLEX. So if you don't pass on your first time in my review, then you stay in my program until you pass, as many times as it takes you. And this is a comprehensive review, so it covers all the major topics that you can expect to find on the NCLEX, and it has everything that you need. A lot of students ask me, if I purchase your review, do I need to purchase any other review along with this? And I tell them no. My students typically just use my review, and it helps them pass because it has everything. It has content, it has the NCLEX simulated questions, it has PDFs, and it has a known instructor. It has me. So I'm here as your personal mentor if you have any questions as you're going through the course. So this course comes with 35 hours of core video content. So what's really nice about this is that you have the option of watching the videos with the slide presentation on the screen, or you have the option of just listening to the audio. So if you are in your car or at the gym, you can just listen to the audio. You don't have to actually watch the videos. So that is a really nice, convenient feature. Also, it has 1,000 NCLEX simulated questions. And these questions are spread across 20 different assessments throughout the program. So it's really going to help you assess your readiness to sit and take the NCLEX. There's also 12 printable PDFs, and it has all the need to know facts on these PDFs. And these are extensive PDFs. Some of these PDFs are like 75 pages long. So you can download them, you can print them. A lot of my students print them and kind of make their own like ebook out of them. So they'll print them and then they'll write notes on them. But it has all the need to know facts kind of condensed into one nice packet for you guys. And then again, it's self-paced, so you can study when it's convenient for you. So there's no excuses. You guys can study when it's convenient for you. And then I'm not going to read through all this, but this is my course curriculum. So you can see this is a very robust course. So we have a whole introduction section. We have practice quizzes and tests all throughout this course. So you can really test your knowledge and, like I said, your readiness to sit for the exam. So I cover every major topic that you will find on the NCLEX: management of care, safety infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacology, reduction of risk potential, physiological adaptation, and then the bonus section is all of my PDFs. So as a little gift for you guys, because I promised I would give you guys something good at the end if you stuck around. So if you are still sticking around, let's start with my UNursity group. So for my UNursity group, I want to give you guys a 50% discount, and this is just for today only, and it's going to be valid for the first 10 members. So if you join today, you'll receive 50% off either the monthly plan or the annual plan. I have it split up so you can do either the monthly or the annual. So the monthly is going to be $9.99 a month, and I'm regularly going to charge $19.99 a month. And then the yearly plan is $99 a year. And the benefit to doing the yearly plan is that you get 2 months free. So you're basically just paying for 10 months and then you get the 2 months free. And then you get all the amazing benefits that I talked about, the coaching community and the access to all of the exclusive content. And then my NCLEX and Chill review. So an even better discount. If you join today, you'll receive a 70% discount. So 70% off. I normally charge $350, but today I'm going to charge $147, and that is going to be that lifetime access that I talked about. So it's really risk-free. If you don't pass your NCLEX, you're not going to pay anything additional. You're going to stay in for free. No subscriptions to worry about, low limited subscriptions to worry about. You'll stay in if you don't pass the first time, but we do have a 99.3% success rate, so I'm confident that this review course will help you pass. I talked about the 100% pass guarantee, so maintain access in my review until you pass, and you have access to all of that amazing content that I talked about, the video lessons, the simulated NCLEX questions, and also the 12 PDFs. And if you want more information on either my UNursity community or the NCLEX and Chill review course, then I will have the links for you in the description box. So you can click on those links and you can head on over there to sign up for either one of those. So, all right, well, we are done with the lecture time. So we're gonna have a couple minutes for Q&A. So if anyone has any questions, and then just bear with me, I am going to put my camera on. Hey guys, now you can see me full screen. All right, I am going to look through my comments here to see what we have, if anyone had any questions as I was lecturing. Give me 1 second, you guys. All right, we hit the beginning. Okay, let me take a look here. Someone said I graduated, did NCLEX 2 times, and want to be successful. I need to pass this now. Well, I have resources for you. I would highly suggest that you take advantage of these discounts for the UNursity community and also the NCLEX and Chill review course. It's really, really going to help you. Students try to do it on their own, and usually doesn't work. It doesn't work. So investing in a complete comprehensive review course, if you are a repeat test taker, is definitely going to be your key to get that content review piece and also to have those practice NCLEX questions is really, really going to help you. Graduate now and scared to take the NCLEX. I know how you feel. It is scary. It is so scary. I still remember, it's crazy. It's like 12 and a half years since I graduated nursing school, and I took my NCLEX. I studied for, I want to say like 4 or 6 weeks or so. And I then went to take my NCLEX, and I still remember like walking into that testing room, and I was absolutely terrified. I was terrified, but I did some of my test anxiety strategies that I have in my course that I talk about in the introduction section. I talk about ways to combat test anxiety and different things that you can do before you sit for your exam. So I did those things, and it really helped me. It really helped me just calm my nerves. I gave myself a lot of positive affirmations that I could do it. And I went in and I passed in the minimum amount of questions. And I was the first one done, you guys. I think it was like 45 minutes or like 50 minutes. And I got up and I walked out and I literally started bawling because I'm like, there's no way I passed. There's no way I passed. Like, I felt like, you know, like I was in a groove. Like I thought that like I knew the information because of the tactics that I had used and like the way I had studied. It really helped me looking back, passing my NCLEX in the minimum amount of questions. But I was the first one done, and I was so terrified that I had passed. But it'll be okay. It'll be okay. You can do it. I like your lectures, how you break it down. Well, thank you. I appreciate that. Oh no, my let me call on my tech guy, aka my husband. Robert, yeah. Can you get my laptop charger? My laptop's about to die. Actually, you know what? I can just use it on here. Never mind. I'll just pull it up on here. Yeah, you can take your computer. Yeah, so I do want to tell you guys, just to give you guys some encouragement, to be extremely transparent. So somebody said that they like my lectures and they like the way I break it down. I had to study too, you guys. I'm not a walking nursing textbook. You know, I have to study this. I have to prepare. And I have to remember and retain the information. I have to use study techniques as well to prepare for my lecture. So, like I said, I'm not a walking, you know, nursing textbook. I put a lot of time and effort into these to make sure that I break them down into easy concepts for you guys to understand and retain. But hopefully that gives you guys encouragement that even nurse educators and instructors, they don't know everything either. They have to study, and finding a good instructor is key, because what an instructor does, like, you may read a textbook and you're not going to understand it, but a good instructor is going to you know, listen to an audio course, or they're going to read a textbook, and then they're going to be able to teach that information back to you very simply, so that way you can understand it. But I still have to study myself. I have to study too. I have to prepare for these lectures as well. My sister said, "Hey Kelly." "Hey Lauren." Hope you're feeling better. I hope you're feeling better. It's so funny as a nurse, you guys. I feel like I'm like the family nurse, so anytime anyone in my family is sick or they have like a medical question, I'm always the go-to. So I'm always giving my nursing advice, and I'm like, text me your vital signs every 4 hours so I can evaluate you. But I think all nurses are like that. Every family has a nurse. Every family has a nurse. I've already joined NCLEX and Chill. What is the other one? So hopefully I answered that for you, but the other one is the UNursity community. So it's a little bit different. The NCLEX and Chill is the self-paced, self-guided course, the comprehensive review course, and then the nursing community, the UNursity community, is basically a network of nurses and and you also get daily like engagement and interaction with me and the other students in the group. So it's a little bit more interactive than the self-paced, self-guided review. But both of them, in my opinion, are necessary, honestly. The UNursity community will hold you a little bit more accountable because you're going to be getting that daily interaction. But the comprehensive review, hands down, you absolutely need a comprehensive review with those practice questions and assessments. So I think you need both. I want to join. Well, I want to have you. I would love to have you. So make sure that you click on those links. UNursity.org is how you're going to join the UNursity community. And then nclexandchill.com/NC will be how you join the NCLEX and Chill review. But I would love to have you as a student.
So I got a question.
Yeah, go ahead.
I'm sorry. So the NCLEX and Chill.
Yeah.
Like, is a 147, the 70% off of that, or is it's already off 147?
No, it's already off. So typically it's $350, but I'm discounting it today 70% off. So it comes down to $147. But yeah, it's normally $350 without the discounts.
Okay, so Is it for both for LP and RN, or is it for RN only?
Yep, it's for both. So the PNs, I just tell them that don't focus so much on the blood product in the parenteral therapy section because you won't really need to know that. But every other section can be applied to LPN and RN. And I have some really good student testimonials. Two of my student testimonials, they were PNs both of them were repeat test takers. I just released their videos, their testimonials, I think in the last 2 weeks, but they're on my YouTube channel and also on my other social channels. But they're both PNs and they're repeat test takers, and they used my course solely, and they passed their NCLEX PN. So I have pretty much similar pass rates for my PN as I do for my RN. So it helps for both. But like I said, if you're going for your PN, you just don't want to focus on the blood products and the parenteral therapies. That's not within an LPN scope of practice. You're not really going to be tested on that.
Yeah, so I'm taking my NCLEX on November for PN. I'm already in the program on RN, but I'm taking the NCLEX on after 40 days.
Gotcha.
So I want to join that program, the NCLEX in chill, but just would like to know which specific for PN.
Yeah, yep. So you can definitely use that for PN, and I will tell you that if you study for an hour a day, you will complete my program in about 4 weeks. So obviously, if you do more than an hour a day, you're going to complete it faster. But if you want more information and you want to enroll in the NCLEX and Chill review, then you're just going to go to www.nclexandchill.com/NC. And again, I do have links for that. And if you're probably in my UNursity community, because my UNursity members typically join through Zoom. But in the featured section in my UNursity community, I have also a video on my program, so you can check that out too. But I'll have those links linked for you in the chat, if one of my moderators can put the link in the Zoom chat for you. And then that's where you can learn more information and then join. And then always feel free to reach out to me if you have any other questions, or now if you can think of anything. I know sometimes it's hard to think of questions on the spot, but yeah, so if you study for an hour a day, then you'll complete the whole program in about 4 weeks, if that helps.
Perfect.
And then if you
so
good. And then if you are going for your RN, I do let my PN students keep the review and use it for their RN as well. So you'll be able to keep that review and then use it again once you're ready to take your NCLEX RN as well.
Okay. Yeah, so if I get the link, I really appreciate it.
Okay, perfect. I'll make sure one of my moderators puts the link in the Zoom chat for you. Info about the NCSBN. Oh my gosh, you guys, I'm leaving you hanging. I'm leaving you hanging. Okay, so I am going to release a full breakdown of all of the changes that are coming up on the new NCLEX, but I'll give you two little hints. Okay, so the new NCLEX is supposed to be coming out starting April of 2023. So it's not going to be like tomorrow. It'll be April of 2023. It will be the new NCLEX. There's some good things. There's also some bad things. I'll give you one good thing. The good thing is that you will now be able to receive partial credit for SATA. So that is really exciting because those SATA questions are difficult, you guys. They're difficult. It was all or nothing. So if you missed just one answer, you would get the whole thing wrong if you missed just one. So now they're going to be awarding partial credit for those SATA questions. So I'll go into more detail about that, but if you want all the deets on that, I'm going to be releasing that in my UNursity community first. So join my UNursity community, and then you'll get all the details on that. Like I said, I am going on vacation next week, so I'm hoping within the next 2 weeks or so, I'll have a video that will come out on the full breakdown of everything that's going to be changing. But partial credit for SATA, that is really exciting. That's really exciting.
Wow.
Yeah. But don't wait until 2023 to take your NCLEX just because partial credit on the SATA.
They're not not changing it now. I'm taking it like in a month.
No, unfortunately not now. It will stay the same until they said that the earliest that they will be changing it will be April of 2023. So, but when you're ready to take your NCLEX RN, it will probably be changed by then. So you'll be able to receive partial credit for SATA. Okay. What is the difference between the community? I have the NCLEX and chill repeat test taker. Got me email to test again. I'm just so down on myself and so scared to test again. So again, hopefully I answered that. The coaching community and content is what is different about the UNursity community, and it's more interactive, more hands-on, more like day-to-day content. And then the course is the extensive, comprehensive, full review for all the topics that you need to know. But don't be down on yourself. Don't be down on yourself. I know that it is easy to get down on yourself, but trust me, I have students that have taken them 5, 6, 7 times to pass their NCLEX. But at the end of the day, all that matters is that you pass, and you will pass. You will pass. Just put in the work. Use your resources. Use me as a resource for any questions. Use my community as a resource. Just put in the work, and you have to really combat that test anxiety. That's another key. Test anxiety really blocks out your memory bank. So you want to make sure that you get that test anxiety under control, so that way you can go in with a clear head and you can bring up that information that you have stored deep into your memory bank. But don't be discouraged. I know, so, you know, it's easier said than done, and I hate saying that. I hate, don't be discouraged, because it's not easy. It's not easy to regain that hope, but I promise you, you will pass. I will do anything in my power to help you pass. Is the comprehensive review on the NCLEX and chill? I have the NCLEX and chill. Yep. Yeah. So it's only one review. So the NCLEX and chill is the comprehensive review that covers all of the major topics that I had just talked about tonight. Somebody said, are you available to talk? If you can send me a private message, I'm happy to answer any questions that you have through private message. But I don't typically like get on the phone or do one-to-one like counseling or one-to-one coaching. I mean, I don't do one-to-one coaching right now. Maybe in the future, but not right now. But if you have a question, feel free to send me a private message on any of my social channels, and I'm always willing to answer. How many times are you allowed to take it? Well, so it depends on the state. So some states have a 3-time maximum where you can take it 3 times. It's not an end-all be-all. So you can take it 3 times, but you can petition to take it a 4th time if you meet certain requirements. And one of the requirements is that you have to complete a remediation course. And I know that the state of Colorado has accepted my course as a remediation course. I was just talking to a student from Florida, and she was asking me if Florida would accept it. I honestly don't know the answer to that. I would have to contact like the Florida NCSBN, but I do know that Colorado, I had 2 students that used my course as a remediation course, and when they wrote their letter of petition to the state board, they had said that they had used my course and they accept that as a remediation course. But that was for Colorado. I don't know about Florida. There's one other state, I can't remember. I can't remember which state that has the 3-time maximum. There are ways around it though. If you don't want to petition to take it a 4th time, then there are ways around it. You can take it in another state. If you are in a compact state, you can take it in another compact state and do it that way, because even if you get your license in, let's use an example. I know that Pennsylvania is not a compact state, but let's say it was, and let's say New Jersey is a compact state as well. So if you live in Pennsylvania and if they had a 3-time maximum, which they don't, but then you fail it and you want to take it a 4th time, you can take it a 4th time in New Jersey, since it's a compact state, and your license would be valid in Pennsylvania and New Jersey if you would pass in New Jersey. So that is a kind of a loophole. It's a way to get around it. But there are only a handful of states that have the 3-time maximum. Most states you can take it. I don't think that there is a limit. Don't quote me on that. I will look into that, but I don't think that there is a limit to how many times that you can take it. I know that you have to wait 45 days in between each exam at a minimum before you can request a new authorization to test. You have to wait at least 45 days in between each exam. But if you're not in one of those 3-time limit states, then I'm not sure. You can always check with your local state board of nursing. Just do like a quick Google search, but I am not sure. I'm not sure what the limit is. I don't know. Maybe one of my moderators can look it up, but I will make sure I have your name. I will make sure to get you that answer.
It varies greatly by state.
Okay. So apparently it does vary greatly by state. So you want to check with your state board of nursing to see what your state is going to require. All right. Did I miss any? Oh, let me move this chat out. All right, you guys. Well, I don't see any other questions coming across, and we've been going at it for a little over an hour. So again, I just want to thank you so much for just spending a little bit of time with me today. I really appreciate it, and I am going to miss you guys next week. I won't be doing a live next week, but if you head on over to my YouTube channel and subscribe and click the bell to turn on notifications, then you will see I will have 2 pre-recorded lectures that will come out next week, Thursday and Friday. So Thursday is going to be the Guillain-Barre lecture, and Friday is going to be stroke. So we're going to talk about the differences between ischemic stroke and hemorrhagic stroke. So that is a really interesting lecture next Friday. So make sure that you head on over to my YouTube channel and subscribe to that. But otherwise, I will see you guys not next Wednesday, but the Wednesday after. All right. See you guys.